Now with the movement of technology, we felt it's about time that the way we communicated with our client group had to change.
The reason we decided to create My Mind was after we did some experience-based co-design interviews with young people. We asked them what they wanted changed in mental health services, how we could make them better. They really wanted extra support in resources, and they also wanted better communications. They wanted to communicate with services in a way that means something to them. They hated telephone calls. Really they wanted instant messaging, and we needed to create something that young people wanted to use, but also that clinical staff would accept.
App My Mind has got two levels of functionality. The light version, which gives you access to resources.
A universal resource offer that anyone in the country could access, where they can find support quickly and easily, and they can look after their own mental health.
And then once you're open to a CAMHS service, the app gives you the functionality to text securely your clinician and your clinical team. It replaces all the phone calls that are missed, all the phone calls that are wasted.
They can use the same resource, the same system, to improve their journey within mental health services, to access support faster, to have more control over their recovery journey, and ultimately feel like they're working towards their own mental health recovery.
Its ability to push and fetch in and out of the electronic patient records. We've tested this with a number of EPR systems, and the functionality is there. It's the first time ever, we believe, that verbatim the patient's voice or text is actually going to be captured in the patient record. If you try to screenshot, it will not happen because the programming in the app disables your screenshot function from your phone.
A lot of people that are close to me have suffered with mental health issues, and it's nice for them to have a way to help themselves in a way that younger generations would like to do it, like with an app on their phones. Because I know I get bugged all the time about how much I'm on my phone, but at least now it's like a nice way to sort of help myself in a way that I like to do it.
It's nice to know that I can help myself, and I like to help other people so that they can help themselves.
Once I was sort of supporting people, and I knew it shouldn't have been me. Yeah, I was being a friend, but there was nowhere to really go, and so being part of this and being able to create this, it presented an opportunity to work on a place for young people to go and for them to actually help themselves or get help from professionals who they can actually talk to and get on with and build a relationship with and know what they're talking about.
In terms of what My Mind can offer children and young people's mental health services, as we've heard from children and young people themselves, actually sometimes all they want is information. They want that signposting, and that's what these resources actually provide them with, to think, what can I do for myself? And then when do I need some extra help? So it's that initial signposting that's so critical that this resource actually offers them.
What inspired EWMHS to invest in My Mind and the digital innovation is the fact that it scales, so you can reach a large number of people through that platform that you can't using traditional methods.
It would have been really easy for us to have done same old, as in management structure, clinical staffing structure. So the brave decision was to actually do something different with some of the investment, to invest in Leeds for digital and My Mind app, investing in people like Emma in China to come and work for us on a specific project such as this. So really it was about not just delivering a traditional staffing structure to do a traditional job with children and young people.
I guess the question that we're always faced with is, how are we going to get this to young people? How are they going to know more about My Mind? It's of course been a challenge because digital and social media within the NHS is very new. But luckily we've had the advantage to work with so many young people who have actually given us an insight into their social world. They've shared so much with us, like what social sites we should use and what they're more likely to interact with, which means we can now mould our digital plans knowing it's going to reach the right audience in the right way, because young people have led us the way.
This app allows the young people to be within their comfort zone. It also gives them an opportunity to access their clinicians as and when they need them, help them to get a better understanding of how they can help support themselves through their treatment modalities, and hopefully get better outcomes for them and support clinicians with their work with them as well.
My Mind is an amazing digital innovation because it brings together what young people themselves actually say that they want, coupled with a passion and a desire by staff to actually respond to those needs of young people, as well as a suite of digital skills that can bring all of that together to really meet needs of the public to improve mental health care experience in its broadest possible sense. It's quick, it's easy, it's accessible. Importantly, it's what children and young people actually say that they want.